Friends, today we will discuss about depth in ultrasound examination. What is the importance of depth now in ultrasound examination? Students, I have already told depth knob is present in every ultrasound machine. You have to find out where is the depth knob present in your ultrasound machine. In any ultrasound machine, all switches or knobs are present in different position. So you have to find out specific knob, where it is present and its function and its uses. Today I am discuss about depth knob. Depth means you have to adjust the depth according to area of interest. According to your area of interest, you have to increase or decrease the depth of ultrasound beam penetration. Here in this picture, look at the picture. On the ultrasound monitor, depth also seen on the right side as a line with markings, with different markings on the line. Look at the picture. On the right side of the screen, there is a line present. It is a line for the depth, and different marking were present. In this picture, the ultrasound beam is penetrating up to 50 centimeter from the probe from the area of examination. In this image, the ultrasound beam is penetrating up to 5 centimeter from your probe or from your point of examination. Then what is the difference between two? Remember, if your area of interest is up to 5 centimeter from the area of examination, then why you are keeping this area? What is the need of this area? This area having no value. If you decrease the depth up to 5 centimeter, that is ultrasound beam penetrate up to 5 centimeter, then it will increase the clarity of image, increase the resolution of image, and the picture quality will be better. Remember, keep your depth as minimum as possible. Keep your depth up to your area of interest. Keep your depth up to your area of interest. Keep the depth as minimum as possible. That means decrease the depth, increase the size of the image. Not only increase the size of the image, it also increases the clarity of image. It will increase the resolution of image. So image which will be produced on the screen having a better quality. Remember, in this image, suppose it is a gallbladder or anything else, you want to do it on ultrasound examination. How to examine it? First, you have to decrease the depth. In this section, ultrasound section, the ultrasound beam is passing up to 15 centimeter, but your area of interest is up to 5 centimeter. Then what is the need of this area? This area having a no mean. You have to decrease the depth. That will increase the size of the image and increase the clarity and increase the resolution. Now I am decrease the depth. How you will decrease the depth? There is a knob present on the ultrasound monitor. You have to rotate the image By clockwise rotation, it will increase the depth. By anti-clockwise rotation, it will decrease the depth. By decrease the depth up to 5 centimeter. Now I am going to another slide. By decrease the depth up to 5 centimeter, it not only increase the size of the image, it also increase the clarity, increase the resolution of the image, increase the frame rate of the image. Remember, by decreasing the depth, increase the clarity, increase the resolution, increase the frame rate. Increase the frame rate, better image will be produced. Remember, at last I am telling, there is a knob present in ultrasound monitor. You have to find out where is the depth knob present. By rotating in clockwise rotation or anti-clockwise rotation, you will increase the depth and decrease the depth also. By decreasing the depth, increase the clarity, increase the resolution, increase the frame rate, so better image will be produced. Remember, keep your depth as minimum as possible. Thank you.